Hello everyone, and welcome back to the Pikeville Medical Center Specialty Spotlight. I'm your host, Carly Lambert, and today I'm joined by PMC dermatologist, Dr. Brooke Hensley. Thank you so much for being here with us today.
You're welcome. Thank you for having me.
So you are fairly new to Pikeville Medical Center, as well as the service line of dermatology completely. So talk a little bit about what dermatology is and some of those services that you offer.
So I've been in the area for about 5 years practicing, and I just joined PMC in August. So excited to be the first dermatologist at PMC. Dermatology is a pretty all-encompassing specialty. We often just get seen as people who treat skin cancer and acne, but I treat all kinds of rashes. Sometimes the rashes lead to internal diagnoses, and so I work with all kinds of specialties in the hospital, which has been a nice change being inside the hospital, getting to work with other specialties as well.
So what are those most common, conditions that you see on a daily basis?
So I'd say every day I probably see an acne patient. Psoriasis is super common in the area. I work really commonly with the rheumatologist to help with psoriatic arthritis as well. Always warts, little kids with different rashes, and then we treat a lot of skin cancers in the area as well.
So talk a little bit more in depth about the treatment types that you see with each of these individual conditions.
So with the rashes, normally, depending on what the rash is, sometimes we do a biopsy and then we start medications. We do a lot of biologic medications with psoriasis, and then we do a lot of Accutane with acne as well. And it just varies what each patient needs. We individualize the treatments for them. For skin cancers, obviously that starts with a biopsy, and then Dr. Ashby, our pathologist, is trained in skin pathology, so she helps make the diagnosis, and then she also, based on what her side says, it determines treatment. So we do anything from skin excisions to scraping off the skin cancer to get the patient healed, and then we often work with our plastic surgeon, Dr. Danikas, or most surgeons in the area to get the skin cancer treated as well.
So with a lot of these conditions, the treatments probably require some form of technology. So talk about anything that you use in a daily basis with your technology.
So every day I use my dermatoscope, which is a specialized type of light. It helps me see deeper into the skin. So especially with skin cancers, atypical moles, things like that, it just gives me that kind of one-up to see, does this need to be evaluated with a biopsy, or is it okay? So every day I use my dermoscopy to help patients.
Awesome. And some of these skin problems are not always just medical. We deal with a lot of cosmetic things as well. So talk about that end of things.
Yeah, so I love cosmetics as well. We actually dedicate a day to procedures. And so we do everything. Like I said, Dr. Danikas, our plastic surgeon, is in the office as well. So we do Botox, Dysport, filler. We also just got the skin pen, which is microneedling, and added platelet-rich plasma, also known as PRP. You can do the microneedling with the PRP, which is called a vampire facial, to help fine lines and wrinkles, or you can use the PRP to help hair loss as well. So we inject it into the scalp too. And we also do chemical peels, kind of all-encompassing skincare. So anybody looking for fine lines and wrinkles, we set aside treatment time for that.
Yeah, and we actually have a specialized skincare brand that we carry. Talk about that a little bit.
So we have two lines. One is Zeo and the other is Skin Medica. I'm a personal fan of Skin Medica. I've actually trained all of my girls, my MAs, in how to talk to patients about skincare. So they do a lot of that for me. And really it's an easy 4-step regimen that I recommend. We get patients started on it, and then that boosts just any type of treatment that you add to it, whether it's Botox or the vampire facials, anything like that. So we love adding skincare to patients. It's helpful that it also prevents skin cancer because you're using sunscreen every day, but it really does make that extra difference in your regimen.
Cool. So talk about that regimen a little bit more in depth. So what are some of the best practices that we can incorporate in our everyday life for skincare?
So just basic, you want to start out is sunscreen. So I always recommend a daily sunscreen. Even in the winter, you're getting enough UV rays to damage the skin. So a daily sunscreen on the face is always the best practice. And then beyond that, it's coming to see us, and we individualize that 4-step regimen for each patient.
So what are some reasons that a patient may need to come and see a dermatologist?
So I always tell my patients, if you have something growing, bleeding, changing, it's been there longer than a month, probably time to come see me. And then also if you have a rash, most people start with their regular doctor and get treatment. If that's not helping, then they normally refer to me to help.
Awesome. So how does that referral process work? They just call in and get an appointment?
It's based off insurance, so some people need a referral and some people don't. Your regular doctor could help you with that process, knowing if you need a referral or not. And then once the referral is set over, my office will reach out and get an appointment with you.
That's really awesome. It sounds like we have some great things going on at Pikeville Medical Center in the dermatology department. And I thank you so much for being here today and taking the time to talk to us. So thank you all so much for watching, and tune in next time for another Specialty Spotlight.